Okay, hi everyone. I thought that if I put that mystery mask on, for those of you that saw me briefly, I'd be able to remove it in the video, but I couldn't see the area to take it away. Anyway, hello, Thursday afternoon, 5:30. The sky a few moments ago was beautifully pink in my part of the world. And welcome everyone. Today we are looking at core muscles in dogs, and we'll probably refer every now and again to core muscles in people because for me we are the perfect examples of figuring it out. And I've got to just close this, otherwise it's going to distract me, sorry. So, I think it's like core musculature, what's the hype? For those of you that are athletes, you'll know that the core muscles are super, super important. For those of you that have had back trouble, you'll also know that the core muscles are super, super important for your sense of well-being. Hi Jean, nice to see you. So we're going to have a look at what makes up the core. Okay, so in people, the core fits, around the body. And typically it's the back muscles and it's the abdominals, the abs. You want strong abs. All right. So it's not really any different in a dog. And I have my Mr. Bones is with me. And I have also created a diagram. So let's just look at what muscles are involved in what we call the core. And then we'll look a little at why they're important. Okay, so let's start with my picture. So I did a bit of preparation. So I hope you're going to be able to see it and that it's going to make sense to you. Right. So the black bit in the middle is the vertebra. So that's all the muscles and the tendons and everything attached to the vertebra or the spine. And in the middle of that round hole is the spinal cord. So, we have to protect that because otherwise our spinal cord gets damaged and we can't walk. So those big orange muscles that lie on the top part, so this is the back, and at the bottom is the belly, okay? Those orange muscles, as a group, we refer to them as the epiaxials. For those of you that have done some anatomy, there'll be some longissimus muscles. There's a few of them which I can't actually remember right now. So, whack me on the knuckles for not doing my research properly. But if you look at the skeleton, they are the group of muscles that runs on the outside at the top. Okay, so there's Mr. Bones' head. Okay, here's his tail. Where my hand is his tail. And in the middle, we have his spine. If I turn him that way, then you can see the muscles that I'm talking about run on either side of the spine. Okay, and before I put him down, there's another group of muscles that lie beneath the spine. Okay, or beneath the ribs, and those are called hip axials. Okay, so if we go back to the picture, they're the ones in red. And the one at the very bottom, which I'm just briefly going to refer to, that one, is part of the psoas group of muscles. So in the dog, so with us they lie on this side, and the epiaxials lie on the outside. So think of a dog lying down, okay? The psoas group of muscles is on the underside of the spine, okay? And just remember it because the iliopsoas is a muscle in dogs that is often injured. And it's often misdiagnosed or it's often missed completely. And when we're working in rehab and when we're working with sporting dogs and athletes, that iliopsoas can be really, really difficult to find and to fix. Okay, so it makes up part of the core musculature. All right, so those are the ones that are on top of the spine and on the underside of the spine, and they are necessary for stabilizing. So if you look at the spine, okay, and you look at it from the top, they're necessary to stabilize all these vertebrae, okay, next to each other, okay, and they're also necessary for mobility. So they will attach to every little vertebra, okay, top and bottom, and as those muscles contract, they're responsible for mobility, okay, mobility and stabilizing. All right, number one, very important set of core muscles, okay. The next group of muscles we're going to look at, so we're going to look at the other group is the abdominals. So those lie around the belly, okay, around the abdomen, and they primarily have to hold the organs in, but they also have to act as a supporting structure. Now in the core groups, we split that into lateral abdominals and ventral in a dog, or the ones that are lying, the ones that make up our six-pack, which is called the rectus abdominis. So those are in a dog, those are then on the bottom. So that term we use is ventral. So if you look here on my diagram again, okay, the green are the lateral abdominals, okay, and they're made up of three different layers, okay, and on the outside here, that tiny little green piece there is actually part of the latissimus dorsi. So in humans we talk about lats. In dogs, the latissimus dorsi is a very important stabilizing muscle. And I'll show you on the skeleton now how it runs, and then you can get an idea of why it's so important. And then the purple that you see at the bottom there, those are the ventral abs, or those are part of the rectus abdominis, and there's another group there as well, and I forget the name. So those are the ones in humans that make up the six-pack. So we want to, when we talk about core in dogs, we're talking about the muscles around the spine and these abdominals, both on the side and on the underside. And we need to make sure that they're strong, okay? Because, I'll tell you in a moment. Okay, let's just finish the short anatomy lesson. I just want to come back to the latissimus dorsi, or the lats. In humans, you know, it lies on the side here, on the side. Those are my lats, okay. Now, if I'm on all fours, where are the lats going to lie? They're actually going to lie here. They attach to the humerus on the inside, and they actually fan up here across the rib cage, and they come and they attach to the top of the spinal cord. Okay, so, and they run quite far back. So they are an important stabilizing muscle. They're very important stabilizer of the front legs, or they hold the front legs in place. So if the front legs are not working properly, the latissimus dorsi is often the muscle that has to hold. Okay, so it's a very important stabilizing muscle. That just as an aside, it wasn't even in my preparation. Anyway, so spinal on top and the bottom of the vertebra, the abdominals on the side and the abdominals on the bottom. Okay, so what's all the fuss? Why are they important? What do they do? Okay, so first of all, the spinal muscles will contribute to rapid movement, force, and power. So particularly in sporting dogs and competition dogs, if you want your dog to perform at its best, you should make sure that those abdominals are super strong. Okay, Regan, hi. Okay, so the other thing that they do, which I've already spoken about, is mobility. So they allow the spine, depending on how those muscles work, remember most muscles are antagonistic, depending on how they work, they will turn the spine and turn the body. Okay? Oh, hello, Neil. The third thing that they do is they rotate. Okay? So it allows me to move like this in a rotational way, in fact, to come up like that. Okay? So when your dog is running and it turns down to actually pick up a ball, or even a fly ball dog, there's a rotational movement in that. So there's flexion to the side, up and down, and then there's rotation. Okay, so flexion is a straight movement, rotation is a turn. Okay, the core muscles are responsible for that. I'm saying okay a lot, I'm sorry. The last thing that the core muscles do is they coordinate the movement of the front and the back legs. And this is vitally important for all dogs. if the core is not fulfilling that function, more and more and more force is going to go down the legs, and the legs then have to work harder and are more likely to become injured. Okay, because if the core is not stable, those legs have to hold, and the more those legs have to hold, the more likely it is that they're going to become injured. Okay, so let's look at what kind of injuries happen if your dog does not have an activated, strong set of core muscles. So the first thing that happens is back injury. Okay, that makes sense. So for those little Dachshunds that we treat with spinal injury, it's the spinal problems in Dachshunds are degenerative, and I did do, I think, 2 talks on it in lockdown, so you can find them on the Facebook page. So they stabilize the spine. Okay, if we have weak spinal muscles and weak core, it means that those vertebrae can move more readily and the play is greater between the vertebrae. Therefore, it is actually creating more tension on the disc. Okay, and what the body tries to do is the body tries to stabilize. The most important areas where we see issues here, if we have poor core strength, is where the lumbar portion of the spine joins the sacrum. So here's Mr. Bones again. Okay, here's his pelvis. All right, tail, his head is that way. All right, here in between the pelvic bones lies the sacrum. And this, let me just position, here where my finger is the top of the last lumbar vertebra. So if I just turn him slightly, here is the lumbosacral junction, where my finger is, here. Okay, that is a very, very mobile part of the body. If you think about those, every time the dog jumps and forces with those back legs, that joint actually has to do this. Okay, so if we have got weak muscles, it means that there's more potential for that joint to hyperextend and become injured. Or with time, what we might get is excess bony laying down around there called spondylosis, which I also dealt with in another talk, which you can find on the Facebook page. Okay. Okay, I've got to stop saying okay. Okay, right, sorry about that. So if you go forward, the next part that's really mobile on the spine is the thoracolumbar junction. So thoraco is the chest. So the last vertebra where we have ribs is the last thoracic vertebra, and then we have the first lumbar vertebra. That area is also very, very mobile. And that's the area in our Dachshunds and our Pekinese that usually has the disc problem. If you think about those dogs with their long backs and how they are moving, that junction has the potential to do the same thing as the lumbosacral junction. And so if we don't have strong core, then we're going to get a lot of excess mobility, movement, and we are going to create a joint that is more prone to injury. Okay, Shami wants to say hello. Hiya. Hiya. Okay, my dog. All right. Okay, down you go. Okay. So the first place, whoops, you stole my microphone. I'm not having such a good day today. The first place that we see an injury then is in the back. The second area we see an injury is the iliopsoas muscle. So remember, I said to you, remember that muscle group called the psoas. So if I come to Mr. Bones here again, that muscle starts here on the underside of the spine in the middle of the lumbar region. It runs underneath the spine and it actually attaches onto the inside of the thigh. If the leg is not on the ground, its function is to flex the hip. If the leg is on the ground, the function of that iliopsoas muscle is to stabilize the spine. Okay, so as the dog is jumping, the foot is on the ground. As he's about to use that force to propel himself over something. In that moment, the iliopsoas stretches and it contracts at the same time, and that's usually the most common area where we get an injury at that time. So if we don't concentrate on conditioning and strengthening that muscle, hi Eileen, then it's part of the core, then we are more prone to getting an injury in that area. The third place we get injuries is the cranial cruciate ligament. So we've done a whole lot of talks on the knee, and the reason that the cruciate ligament is that stabilizer between the femur and the tibia. If we don't have strong core and those legs have to work harder to hold the body in place because the core is not doing its job, then we're going to get more action on this ligament and it's going to be more likely to tear. The last place where we see injuries is the shoulder, okay, particularly on the inside. Again, if the dog can't hold its center of gravity and its core in position, then these legs are going to have to work harder to hold themselves in place, and they're likely to slip, and then we're likely to actually get an injury on the inside of the shoulder. Okay. Okay. And okay, so what happens is, what's all the fuss about the core? If we strengthen the core muscles, we are less likely to have to pay for expensive surgery. That's the bottom line. And that's where, as a rehabilitation practitioner, I have a particular interest in core strength and core stabilization. And I've just been fortunate enough to present a webinar to my colleagues about hind limb awareness in puppies. And the reason we want to create that hind limb awareness is so that we can also focus on strengthening the core. So there's a lot of things that go hand in hand. I firmly believe that the more we can focus on strengthening the core, the less likely it is that your dog is going to end up with an injury and going to require surgery. Is it 100% foolproof? Absolutely not. But we can and we should be exercising our dogs and activating those core muscles. There's a few rules that are that need to be applied when we look at strengthening the core muscles. And I'm just looking at the time here because we're pretty much coming close to the end of the session. And I don't want to rush through this because there is a lot that needs to be run through. There's a lot of rules and there are a lot of things that need to be taken into consideration. So I'm going to suggest that I do the second part of core stability and strength next week. So here's a few questions. I can't see them all. D, van Enter. What about a mastiff with one front leg? Yeah, so it would have been ideal if the core muscles were strong beforehand. What I do like about, what I do recommend for amputations, especially of the front leg in such big dogs, is swimming. So swimming is a very good exercise for activating the core, and because it's a giant breed, that front leg, if we do too much on the ground stuff, the carpus or the wrist of the remaining front leg is, they've shown in research, that's the joint that next takes strain as a result of the amputation in the one leg. So D, yes, it can be done. I would be looking at once he's found his balance, and as physios, we can also help him back into balance now with 3 legs. It can be difficult for some of the very, very big dogs. And then we move him into the pool and we swim him. My preference is not to use the underwater treadmill with amputees because I think we just exacerbate a compensated movement, whereas in the pool, it's a completely different movement. That's my personal opinion. There's not any research that I've seen yet that supports my observations. But definitely, I would say we can work on him, and my modality of choice once we've got him stable would be the swimming pool. Excellent. So any other questions? Have I missed anything? I'm not sure I can scroll. I can scroll. I see everyone who's been here, everyone who's watching. I don't see any other questions. So what we'll do then is we'll close it off for this week, And we'll do part 2 next week, where I will look at the exercises that we can do, but there are certain rules with regards to the ages of the dogs and what's applicable and what's not applicable and what we're trying to achieve. So thank you very much, everyone, for your attention. And please share it if you found it interesting and you think that there are people who should know about it. Please, by all means, share the link. Thank you very much and have a fabulous Thursday evening.